Good evening, everyone. My name is Joelle Wazin. I'm an ESIR resident at the University of Massachusetts, and I will be moderating tonight's 9th episode of the SIR-RFS Leadership Webinar series with my colleague Monica Uceda, VIR Fellow at the Medical College of Wisconsin. Today's episode is very special and is titled Becoming a Great Leader. With great power comes great responsibility. Tonight's guest speakers need no introduction as they are pioneer women in IR leadership. Nonetheless, I'm very excited to introduce Dr. Victoria Marx and Dr. Laura Findeiss. Former SIR President Dr. Victoria Marx is a professor of radiology, vice chair of education and residency program director at the Department of Radiology of Keck School of Medicine, University of Southern California. Dr. Marx completed her radiology residency at Ohio State University and then pursued fellowships in abdominal imaging and interventional radiology at Washington University, St. Louis, where she became the first IR fellow. She then joined the Department of Radiology at University of Michigan, where she became section head of interventional radiology and director of the IR fellowship program before she joined University of Southern California. She has had numerous leadership positions in the Society of IR, including president, and has played a critical role in the evolution of IR training from fellowship to residency. During her term, Dr. Marx focused on diversity and inclusion as well as IR outreach among medical students. Dr. Marx, it is such an honor to have you.
Thank you very much for that kind introduction. I'm happy to be here, and I very much appreciate that you didn't add what years I was at all those places.
It would have taken a couple more minutes as well. Next, we have the pleasure of having Dr. Laura Findeiss. Current SIR President Dr. Laura Findeiss is also Chief of Service for Radiology at Grady Hospital and Professor of Vascular and Interventional Radiology at the Emory University School of Medicine in Atlanta. Dr. Findeiss comes from a diverse professional background that includes 2 years of training in surgery at the UT Graduate School of Medicine, as well as practicing emergency medicine in rural Tennessee. She then completed her diagnostic radiology residency at Virginia Mason Medical Center in Seattle, following by a fellowship in VIR at the University of Washington Medical Center. She occupied numerous leadership positions, including Chief of VIR at the University of Utah, Division Chief of VIR, and Co-Director of UC Irvine's Ablative Oncology Center, and Chair of Radiology for the UT Graduate School of Medicine. Dr. Findeiss is certified by the American Board of Vascular Medicine in endovascular medicine and is a registered physician in vascular interpretation. She was also honored with fellow status in the American Heart Association in addition to her FSIR status. Dr. Findeiss is an advocate for multidisciplinary collaboration and global outreach. Thank you for joining us, Dr. Findeiss and Dr. Marx.
Thank you.
Thank you so much for the really kind introduction. And I know both Vicki and I are really excited to get to share some of our experiences with the group and also to answer questions from the group. We have some slides that we do want to share, but we don't want this to be like a really stiff presentation. So as I go through some of this, I'll be asking Vicki some questions, kind of getting her thoughts on some things, and then also really want to hear from the group about their thoughts or questions as well. I'm going to start sharing my screen.
That's great.
Can you see that?
I can.
Okay, great. Good. So the title that we were given, and Vicki and I chatted about this, becoming a great leader with great power becomes great responsibility. And I think, you know, both of us thought it's an interesting perspective to think about power when you're in leadership. And really, I think the most effective leadership is really more about influence than power. Most of us don't have explicit power over anything in our lives, including even when we're giving leadership positions. So I want you guys to think, as we're talking about, you know, how you can influence change, rather than how you can leverage change through power, because I think that's probably the more effective way to approach the idea of leadership. I'm going to go through the formal slide parts here. So neither one of us has any conflicts. And the CME statement from the SIR. So first off, when people talk to me about wanting to be in leadership or asking about leadership, my first question to them is why? You know, why do you want to be a leader? And I think it's really important to articulate to yourself what it is you're trying to accomplish, because leadership in and of itself isn't really a goal. So you need to be thinking about, you know, what are the core principles in my life that I want to advance through the privilege of leadership and the ability to lead other people. And so as I think about, like in medicine, what is the point of leadership? What are the things that we might be trying to accomplish? It may be about patients. It may be a passion for, you know, improvement of the patient experience or patient outcomes. It may be a passion for seeing an improvement in society overall. It certainly can be for a sense of accomplishment. And I think that sense of accomplishment can sometimes help to continue driving us forward. And so I think that can be a positive. Leadership can provide a tremendous amount of variety in your life. You know, it's much less boring to have challenges in front of you. And so I think that variety piece, again, is a very good reason to want to go into leadership. I think there's an incredible amount of personal growth that comes with leadership. There's a lot that you need to explore about yourself and the way you interact with others in order to become an effective leader. You know, there's the personal recognition that comes with leadership. And, you know, occasionally I think for some people it is about just kind of grabbing that next rung on the ladder. And that's probably the worst reason to go into leadership, because there are a lot of frustrations that come with leadership, and doing it for that reason alone is probably not a great idea. Just in terms of personal growth, I'm sure Vicki will have some things to share about sort of the introspection piece that comes with becoming a leader, and I'll be able to share some things too. So as far as patients, what are the reasons why we might want to do leadership focused on patients? We may think we've got some great clinical innovations. We may be really focused on patient safety. We may want to facilitate improved teams, so safer patient care through great teams, or better patient outcomes through great teams. For society, you may be looking at operational process improvements, you know, things like decreased costs of healthcare, improving access to care for certain segments of the population, and improving the health of those populations. Rewards of accomplishment, like we talked about, it can be very gratifying to see your own efforts causing improvement. You may be one of those people that's really compelled to fix problems. And it's nice to be able to coach and mentor others to success, and that's one area of accomplishment that could come out of leadership. And we already talked a little bit about variety. So I think as you think about your why, then the path to leadership will kind of depend on what that motivation is to lead. If your why is about patient care, you're going to take a very different direction than if your motivation is about, say, organizational improvements or, you know, society. Those may be different roles you want to get into to focus on that. So identifying your why is really important so that you know what path you want to follow to the right leadership position for you. It also helps you to you know, as you're trying to move into leadership or trying to get your ideas promoted, knowing your why really helps to create that elevator speech, or to articulate, you know, what is your envisioned future as you're trying to articulate that to others, and creating that clarity around why you want to be there. And then it can help you to define your path to leading around that why. So what are the things that leaders do? Ideally, they help themselves and help others do the right thing. So again, kind of focusing on that big why question, why do I want to go there? You have some ideas about what's right. And those right things should really represent your true north that help you to drive in a particular direction. And then help yourself and help others to do the things that will drive towards that true north. And this is where we really get into that idea of transformational leaders who are able to articulate that inspiring vision of the future to others and can motivate others to engage with that idea of the envisioned future and kind of move forward. They might need to, sometimes the people around you might not be able to see the path to success. It seems cluttered with the failures of like previous tries, and clarifying how you can get people to that successful envisioned future is a really big part of that inspiring vision and that transformational leadership. And then motivating and coaching others to achieve that goal. I'm going to take a step back here and just ask Vicki, can you think of some times, you've been engaged in leadership in the residency for such a long time and really done a lot to change what education looks like in IR. Can you think of ways that you were able to articulate that vision to others, or how you were able to act as a transformational leader?
Thank you very much. So I'd like to even step back. If you go back to your slide where you talk about climbing a ladder. Because early in my career, much earlier in my career, I was on the executive council. I ran the meeting, and all my friends were moving on to higher levels of leadership, either in their own home institution or in SIR or something else. And I applied multiple times to be secretary of SIR, and I never got it. And in part, I was doing it not because I had a mission or saw myself as a leader, but I was doing it because all my friends were. And I think I didn't articulate it at the time, but I think I was engaging in arbitrary ladder climbing because I thought it was what I was supposed to do. And I didn't get it. And I was disappointed. I was a little bit peeved. But then some things happened in my life where I had to completely step away. There were issues in my personal life and in my family that I had to deal with. And so I took my desire for leadership back home. I was working and all that stuff, but I wasn't really active in SIR. And then the whole residency, probably in about 2010, 2011, the whole path towards a residency was ramping up, and I was asked to get involved again. And by that time, I was a little more mature, and I clearly, just viscerally inside, knew that the residency was the right thing to do. And part of that, I think, is because I went into radiology in 1982, specifically to do interventional radiology before anybody even called it interventional radiology. And so I was kind of on the bleeding edge of people thinking of it as a career goal straight from medical school. So when flash forward to 2012, 2013, this is all coming around, and I basically got asked to take a leadership position. The reason I did it is because I so viscerally believed in it, and part of my visceral belief in residency being the right way to train interventional radiologists, and the fact that we're a primary specialty with 3 pillars, patient care, imaging, and technical procedures, that I could communicate that to other people, other stakeholders, specifically people within the world of interventional radiology and people within the world of diagnostic radiology training, so that I could make it all seem possible. And I don't think I did that alone, but I think that's the reason that I was asked to assume a role of leadership, and the reason that it all came naturally to me, because I believed it, and I'm a glass half full person and a pretty direct, clear communicator.
Yeah, I think that is just a really great example, right? Because you could never have been so effective in your leadership around the residency without having that passion. And sometimes the time isn't right for you to be the right leader.
Right, yeah.
And so, and you may be great but it may not be the right time. And sometimes you have to land on the yellow brick road, like at the right time, right?
Right, exactly.
Yeah, I mean, I think that's a really great example of how, and if you're just pushing towards the ladder climbing, and that's what it's about for you, you're going to be blinded to when that sweet spot might arise, you know?
Oh, yeah. Well, I would have sucked.
Awesome.
I wouldn't have been very good at it.
Right, because then how do you act as a transformational leader when you don't have that burning passion for the issues at hand?
Right.
You can't. Right.
And one of the other aspects about leadership, especially in a complex organization like this, is we all, in positions of leadership, you're not alone. And you very much have to be honest with yourself about what are the things that I can't tackle, that I'm not going to be the spokesperson for, and open the door for somebody else to be that spokesperson that you know is going to be better than you.
Yeah, absolutely. Right. And again, that's about having passion for that true north and not passion for your own recognition. Right. Because if it really is about that true north, you're going to step aside when it's appropriate for somebody else to be the right leader at that time. Yeah, I think that's a great point. And right, leadership is not a solitary experience. I mean, it can feel kind of solitary at times, depending, but it's also, you're only successful through that collaboration.
Right.
With other smart people.
It's so important.
Well, cool. Thanks for sharing that. So I think, yeah, so we were just talking about this, right? So how do you do it? I mean, these are these core essential qualities of leaders that Vicki was talking about, you know, having that sincere enthusiasm, you know, about what it is you're trying to accomplish. I think integrity is really key. Like, people around you really need to trust you. You can't look like you're out there for yourself. Like, whatever story it is you're telling about why you want to move in a particular direction, you better be true to that. If people see through that and that's not the case, you really can lose your followership. You know, being able to communicate well with lots of different types of constituencies in order to share that vision. Having loyalty to the people who are working with you at whatever level, being decisive. And I do think at times it's critical to be able to make the hard decisions that others may not want to make. Being competent, obviously. And I think really huge is empowering other people. Like Vicki said, sort of stepping aside and being able to empower others who have the right strengths and talents to move things forward. So, you know, again, I'm going back to when Vicki and I were talking about the title. There's this danger in the illusion of power because you can forget all of those other core values and that collaborative piece in it when you start making leadership mistake number one, which is thinking that you're in charge. And it's very, very rare to have any kind of a position where you're truly in charge and that you can just sort of by caveat, like, rule that things are going to happen, because people really only move off of where they are if they want to, and so you really have to be able to sell them on that idea.
Right.
And, you know, I'll share a little vignette for myself, and I'm kind of telling on myself because my first job out of fellowship, you know, I thought I was, and I think a lot of us get out of fellowship and we think we're all that in a bag of chips. Like, you just think you've got it all dialed in, you know, all the greatest new techniques, you're the best person in the room, and everybody ought to do things the way that you think they ought to be done. And I really suffered, I have to admit, I really suffered from that. And I was given a leadership role by my boss / partner, sort of running the lab. And I decided that I was in charge. And I looked around and saw everything that was wrong and started trying to tell everybody, you know, all of these people who had been doing these jobs, the techs and the nurses and everybody who worked in that environment and had this really great team, I started telling them how things ought to get done. And you can imagine how that went down. I was the most unsuccessful director of that lab of all time. But it was a really important learning experience for me because it really forced me to reflect on the reasons for my own failure. And this is that self-reflection piece that comes out of failure, and this whole idea of, embracing those failures and failing forward, because, we all screw up and we have to own that. Vicki, do you have any experiences like that where you sort of thought you were in charge?
No, I was put in charge, but I knew I wasn't in charge. So my situation was that I was appointed section chief, and a person much senior to me was asked to step down as section chief, and another person more senior than me was passed over so that I became section chief. And I knew, and I'm not sure why I knew it, maybe because I'm female, I knew that the only way for me to get anything done would be to individually get both of those guys on my side before I did anything. And it was a huge amount of work. And I actually think, I think some of it was sexist, but I think some of it was just age, that I was younger than both of them. And I think a young guy would have had some of the same difficulty, although maybe not as much, or maybe I wouldn't have perceived it as much. But I was given the illusion of power, but I knew I didn't have it. And then I think in my experience with as a program director, you tend to have a little bit more, you can be a little bit more autocratic, kind of locally, just to make sure that you're playing by the rules. And if you tell your colleagues they have to play by the rules that are the ACGME type rules, then everybody just falls in line typically. And in an SIR, I think the overwhelming responsibility, the idea as president of SIR that I actually had power never occurred to me.
Yeah, and I'll get to some of my thoughts about that later. But and I've had both of those experiences too. Sort of being put into the chief position when somebody else was displaced, and then being put in a chief position when somebody internal was passed over. And both of those people had a tremendous amount of resentment. And it takes a lot of, each time you go through that experience, you get better at sort of managing that relationship. But you really have to get people on your side for sure. So I think one of the things, as I've thought about, how to become successful in leadership, as I look at when I've been successful and when I've failed, I think the thing that is probably most effective as a tool is curiosity. And I think that probably, Vicki, as you navigated those relationships, probably part of the way that you would have overcome those barriers is by sort of understanding where those people were coming from, and sort of understanding
learning to listen, and then acting on that, and talking in ways, speaking with people about their issues, or about the issues that you're facing, in ways that other people will listen to, takes a lot of practice. Listening effectively,
it really does, right?
And then
I think hearing the way people use language, hearing they give you cues, right, of what matters to them, and then being able to hear those cues and then tack whatever it is you're trying to accomplish onto sort of their value system that you're hearing from them. But I think that takes some sincere curiosity. And again, this is an area where I had to grow a ton, to learn to listen to other people, and really hear where they use their own momentum, their momentum for success.
Well, I think you had to use those skills when you were doing the initial exploration of the private practice IR world, right?
Yeah, right.
That's a hugely disparate group of people.
yeah, a lot of people with a lot of different agendas and a lot of different things that matter to them. And, all of those things are legitimate because that's where those people are living. And being able to hear all of those concerns and sort of figure out like where are the commonalities, what are the things that we can come together around that matter to everybody. Finding that consensus is super important. So again, just kind of going back to those principles for growth and leadership, knowing what you're trying to achieve. What do you want to see better? Really crystallizing that in your head, and that'll change over time. But usually, sort of your true north purpose will be consistent throughout. And then the fundamental tools of being a good listener, using collaboration, creating sustainability around relationships, and then being strategic in terms of how you're going to use those relationships to move forward. So, and I think it's important too to recognize that there are a lot of different types of leaders, and you don't have to be in a formal leadership position to lead and be very effective in getting things done and moving things in a direction. And actually, sometimes you can be more effective when you're not in the spotlight of that leadership position. And it's a great way to sort of learn how to lead without having the pressure of leadership on you, to be sort of to use the informal leadership positions that you may be able to find where you can just influence other people. And some of the ways, I mean, there are a lot of different constructs that you can look up on the internet, and so this is just one of them. But the ways that in your own world, without having a title, you can lead every day. And these are actually great ways to distinguish yourself in your circles, in your professional circles, in your organization, and be recognized as an informal leader, and then actually sort of be invited into the more formal leadership structure. And so people will refer to the pride. What? I'm sorry.
That's awesome, I said.
No, yeah, no, right? It is awesome because, and it might be good to even just try to see yourself in one of these positions, like which of these things is really me. There are the sort of cheerleaders, the pride builders, the people who kind of can rally people around a cause. They're really excited about their organization. They demonstrate that on a daily basis, and people kind of gravitate towards them because they feel that positive energy around things that they're trying to do. The exemplars are people who always just, other people really look up to them. You may do excellent work. You may be like just a really talented interventional radiologist, and your patients really love you, and you're always setting that example every day of just the way to work. And that can be a really great way to lead. Networkers are those people that can find those connections between people when you identify, oh, this person really cares about this issue, and this person in the other department also really cares about this issue, and I care about this issue. Maybe we can bring these people together around this common area of interest and form a coalition to kind of push this issue forward, and make things better in our organization. And you can really get recognized for that, and that's something you can do informally very easily. And then the early adopters, people that, maybe you see something on the horizon that you think would be a great addition to your organization, and you can help to lead by being one of the early adopters in, say, an initiative that's happening in your hospital, or bringing on new technology that, that can really improve things. And so as you're thinking about how to informally lead, maybe thinking about these different categories. And then, again, different types of leaders are going to affect change in different ways. So there are also sort of these formal leadership roles, depending on what you want to accomplish. You may choose a particular, formal leadership path. So, for process improvement or doing organizational committees are great ways to just be a frontline grassroots leader. Some of the things we just talked about, but also just getting as engaged as you can in as many committees at your hospital as you can to just sort of drive change on the front line. If you're interested in clinical leadership, those are, the division chief or department chair kind of roles, or operational leadership like a COO role or like a hospital side, vice chair for clinical operations or something maybe a leadership role that you may kind of key on if you want to do more system change operational stuff. Society and association leadership obviously is sort of why we're all having this conversation, and it's also a really great way to drive change. And then through political engagement, national ops, et cetera. Now, Vicki has been very involved with accrediting bodies around education, and now is involved with the ABR. And can you comment a little bit about how that may be similar or different to your other roles, your other leadership roles?
That's interesting. It's you have, I would say, the ABR and then the ACGME, the Residency Review Committee, have I would say more clearly defined and smaller domains. So the domain of the RRC is to make sure that residencies are complying with program requirements, and there's very defined ways of how residency programs are assessed and what happens if points of non-compliance are identified. So it's a little bit, it's a much smaller sphere of influence, and the importance of the group is to make sure that the entire group agrees, the whole RRC agrees on stuff, so no one individual could negatively influence a program, that they have to achieve consensus on decisions that the body makes. And the ABR basically has a very different but important limited scope, which is that the medical board is the body that is stamping the professional passport of each individual, saying that yes, this person has done the training and has proven that they have learned the material needed to practice the specialty effectively and safely. So the boards really, they're serving the greater society. They are the ones that are telling everybody's grandma and grandpa and little kids around the country that yes, these doctors are qualified to do what they say they're going to do. So I would say it's not part of my role in leadership in SIR was to advocate and to convince people that something could happen. And that's very different than making sure that the rules are done right and people are abiding by them and people are getting trained right, and that people who say they're radiologists, interventional radiologists or diagnostic radiologists are actually qualified to say that. So they're very different.
Yeah, and that's interesting because that kind of speaks to, yeah, no, it did. I mean, it made me think of like the culture of different organizations and how, you know, your leadership style or the way you like to work probably needs to align pretty well with the culture of the organization you're wanting to lead in. Right. Because I can imagine if you're sort of a networking consensus builder kind of leader, and like you like to see rapid change, but you're probably not going to get like super jazzed about the more granular sort of nitty gritty, accrediting body type leadership. That might not be your style. And so it's an interesting thing I hadn't really thought about.
Yeah, but the flip side is that coming from a specialty that's new, and being part of making decisions on how the residency should run, I mean, and making minor word changes in the program requirements can have huge downstream effects. So yeah. I do bring a background that can help say, hey, there's a word that needs to be changed, and here's why, and do some conversations within the RRC to say, yeah, we need to change this. And if people come along with it and it all makes sense and people check with outside interests and things like that, then we change something. But it's very not done with the idea of being innovative. It's done with the idea of being, this is what society needs.
Yeah. And right, the shall versus the should.
Yeah. Oh, yeah.
Whatever.
Yeah, right.
Has huge implications. So there's that strategic sort of scenario planning, like what is the long-term major effect of that? So I was just trying to doodle on PowerPoint, which this is about as sophisticated as it gets for me. So I'm very proud. But I was thinking about, like, most people have probably heard of the PDSA cycle of quality improvement, where you do your plan, do, study, act, kind of a continuous cycle. And I was thinking about, well, like, so what kind of a cycle? Because I do think, I think transformational leadership is really about these cycles of change as well, because a lot of it is culture change, and culture change is really slow. And so you'll have these like iterations of trying to get people gradually changed to the way you may want them to see things, or, you know, whatever, aligning with sort of your envisioned future. And so I was thinking about, you know, well, how do you do that? And the first part, it's like what Vicki and I were saying, is like listening to people. So that to me is the study part. When you get into a leadership role, or you get into an organization where you want to make change, sitting back and sort of studying the landscape and learning about the landscape and hearing where people are coming from. Again, having that curiosity, listening for, you know, the key themes that are coming out of different corners, and understanding sort of the history of the organization and, you know, where the organization sees itself going, et cetera, is that sort of study part of really listening. And then based on what you're sort of learning, then planning, well, you know, what coalitions would I benefit from building around this thing or that thing that I want to change? You know, who are the key drivers of change in this organization? What do they care about? And how can I align with them? Or how can we create, you know, a coalition of people aligned around something that they want to change? So that's kind of the planning part. And then building those collaborations to kind of then figure out, you know, what are we going to do, and then doing it. And then again, you know, once you've done it, sort of stepping back and seeing, you know, so we pulled this lever, what has changed? And, you know, then what next? And I do see it very much as a cycle, and not expecting big change all at once, but sort of, you know, figuring out what kind of incremental changes. Congratulations. Vicki, do you have any thoughts about that?
Yeah, well, the one thought that comes to mind is that it would be a mistake ever to pursue or enter a position of leadership, whether it's low on the food chain or high on the food chain, without accepting the fact that you're going to be either creating change, reacting to change, or managing change, or all three. To think you can get into a position of leadership and everything's going to stay the same never happens.
Yeah, and honestly, to me, why? Like, why would you? I mean,
right.
You know, to be part, like, because that's caretaking, right? I mean, that's not really, to me, that's not really leadership.
Right.
I think leadership really has to be visionary. Yeah, but you know, everybody's a little bit different, and but I would find that super boring. But yeah, planning for change and like embracing the idea of change is really critical. And then just thinking about rewards of leadership, I think the biggest reward of leadership to me is seeing your ideas tested. So all of us, I think everybody who's on this call has great ideas, right? Like you see things that are broken, you have ideas about how they could be better. And one of the great things about being in a position of leadership is that if you do it I think if you do it well, you'll have an opportunity to see those ideas tested. And sometimes you'll be wrong, and you have to be willing to accept that you were completely wrong. But you get an opportunity to try, which I think is a real honor. I think it also, it just, as you try to test your ideas, you also get a better understanding of the system. So when you discover that you were wrong, discovering you were wrong actually gives you ideas about, well, you know, what's the next thing I want to try, and why didn't that work? I think the opportunity to collaborate with others and learn about what other people do, and you know, what matters, you know, what are all the different pieces of the healthcare system is really exciting. And I've learned so much about, like, just the corners of the hospital, and all, you know, radiology in particular. The operations are so complex. We touch so many things that I just get, you know, I get to learn every day. Vicki, I'm sure you feel the same way.
Mm-hmm.
Like,
oh yeah, absolutely.
I mean, even beyond, I think as interventional radiologists, we get that anyway, because we get to interact with so many different clinical partners. But then it becomes even bigger when you're getting to sort of be on that leadership stage where you're really having to pull on a lot of different threads in the organization.
Mm-hmm.
I talked a little bit before about empowering and supporting others, and I think, Vicki, this is probably where you really have had a tremendous opportunity as a residency director, and you know, all of the ways that you've gotten to grow other people.
I I think in my role in SIR, I've been able to, you know, so when you're in a position that you need help, and you realize somebody's doing a really good job, so you give them more to do, and then they realize they're getting more leadership, and then later on they thank you. It was very nice. Plus they helped.
Yeah, well, it's funny, right? Because when you think about your mentors, your mentors probably at some point were actually kind of using you a little bit.
Oh yeah.
You know, like
absolutely
using you to get something done that was really important to them, and then you were like a good partner to them, so they wanted to mentor you more.
Right. Exactly.
So I think being a good mentee, part of that is stepping up to the plate on things that need to get done, because that does build it's like that informal leadership thing, right? It builds your reputation as somebody that's reliable and has follow through and has good ideas or whatever, and then you get that next opportunity. For me, the personal insight and growth, I think I've brought this out before, and I'll say my years as a chair were some of the most challenging personal growth years in a professional context, because of having to lead at that level can be very challenging, and makes you really kind of look at the way you interact with people, and kind of evaluate whether your style is actually effective. Like you've had whatever you've been doing got you to where you are, but it's not good enough to get you through that next step unless you're willing to be very introspective. And then I already talked about learning outside of your expertise. So as the title sort of said, you know, with great power comes great responsibility, but really, I think the responsibility thing comes first. And those responsibilities are really important. So it's important to recognize in your leadership role that you have these responsibilities. You have a fiduciary responsibility. You are responsible for the well-being of the thing that you're responsible for, first and foremost. You have the responsibility of loyalty, responsibility of confidentiality. And again, Vicki, I know for you as a residency director, having trained so many individuals, that confidentiality piece is so critical.
It's huge. It's huge. If something's going on that's private, or you're being asked to comment on something that is confidential, you absolutely have to respect that, because once you lose people's trust, it's over.
Yes, right, totally over. And I think the other part of that is that impartiality piece, because you may have somebody really pulling on your heartstrings on one side, but there may be another side of the story or another piece of the equation, and you really need to look like you're giving everybody a fair shake. So I think that impartiality part on top of the confidentiality part is really critical to being a trusted leader. And then being accountable, and especially, when you make mistakes, because we all make mistakes, and, and mostly we'll remember all of our bad mistakes, but taking responsibility for them and being accountable for the bad calls you might make is an important responsibility.
I've got back up. So one thing to remember in leadership is the responsibility. We all lead really busy lives, and as I was president-elect and then president, I would say it was mostly during the president-elect year, I would wake up in the night worried about managing some communication thing, or how was I going to handle this, or who do I need to talk to, and the responsibility weighed on me until I started to tell myself that it's going to be fine. You'll figure it out. You don't have to figure it out this second. Nothing ever happens as quickly as you think it should, or as you want to, and that it'll just be fine, and you just have to be yourself and accept the fact that you've got this responsibility, and then you can go back to sleep.
I love that.
And wait, there was one other thing. Oh, and the accountability thing. That's huge, and you absolutely have to be willing to say when you're wrong. So during my presidency, we started the underrepresented minorities. I forget what the name of the section is, and the first way that we as a society were going to implement it was totally wrong and didn't take into account the constituency we were trying to serve. And I just had to say I was sorry and start over. And I think I accepted the accountability to a level that it was accepted, and things got off on a much better foot. Don't you think, Laura?
Yeah. Oh, yeah. I mean, I remember how challenging that was, and everything was done out of the best of intentions, but with the blinders on, and we all sort of marched down that path. And I think the most important thing to do at that point was what you did, and you went before a group of people and said, "I take complete responsibility for really screwing this up," and it can be the hardest thing to do, but absolutely the most powerful 2 words in the English language are "I'm sorry."
I'm sorry.
Especially if you mean it. I mean, if you don't mean it, then forget about it. But, it is. You just have to fall on your sword sometimes, and it's the right thing to do. But most of the time, you're not going to screw up nearly as badly as you think you're going to. So like all of the perseverating about how everything's going to, fall apart is probably not worth it. And you're never going to anticipate that really big screw up. So you can't really plan on the screw up.
And you're really never alone. There's always somebody you can talk to help work through it.
Yeah. Yeah. And that's really critical, having those people that you can talk to. I think sometimes I often joke that in many of my roles, I've just had the honor of being the chief complaint receiver. So there's, I think the higher you get on the food chain, the more complaints just blow up to you. And again, I've learned to say I'm sorry a lot, and it should always be the first thing out of your mouth when somebody has something they want to complain to you about. I think it can be very challenging to maintain your confidence during setbacks. And it's something I think that you have to have a lot of confidence to be able to get to that place where you can maintain enough confidence during some setbacks. And go ahead, were you going to say something, Vicki?
Yeah, so this list, it's a lot like motherhood.
And I haven't done motherhood, but this is plenty.
It's very similar.
Yeah. Yeah, I think, sometimes people don't understand the barriers that you're up against. And so being able, without making a lot of excuses, sometimes it is important to articulate to the people that are relying on you, like what are the concrete barriers that you're up against, just so that they understand why you're not making any progress. You can't make everyone happy. And, you hear that, but it's really very true. More likely to make everyone unhappy. But as long, I think, as you're pointing to your true north again, because you believe it's really true, then sometimes you do have to make people unhappy. Bureaucracy is awful, and I think until you're really in a position of having to move things forward in an organization, you really just don't have a good sense for what the challenges are. Nothing ever moves fast enough. I think you get more understanding of it over time. I don't know if you become more patient with it, but you just understand that it's the reality, and that there's this pace of change that you can't change. I think one of the interesting things is, really inviting others' perspectives and dissent, really being open to diversity. I think you can say we're open to diversity, but then if you shut down other people's ideas, then you're not really. And sometimes you're not going to learn that you're wrong until you actually let somebody tell you you're wrong and examine why that, may be the case. And again, we already talked about owning mistakes. And yeah, culture. I mean, culture, don't underestimate the difficulty with changing culture. Nothing's going to change just because it's a good idea. And then prices of leadership. None of this is meant to be like a downer or anything, but I think it's some of this stuff you don't really anticipate when you step into a leadership role, how much of this stuff is in play. Like Vicki said, she lays asleep at night kind of thinking about stuff, and there's just like a bottomless pit of stuff to get done, and you can never really do enough, and you just have to understand that you're not going to be able to do everything at once. You'll be blamed for failure. You can feel alone, which is why like the home, having somebody supportive is really, really critical. One of the things that I think is interesting is that you lose a lot of your own personal voice sometimes in a leadership position, because you have to speak with a voice that's supportive of everyone. So you don't really have free speech. You can't really just say what you think all the time. You have to be cognizant of how what you say or what you do or how you act can impact other people. And I actually found that one of the biggest surprises of the visibility of a leadership position. Vicki, have you?
Yeah, no, absolutely. You can't. You always have to be cognizant that what you say will be thought to be what the SIR says. If it's the SIR leadership or whatever organization you're a leader in, you have a responsibility to not tweet stupid stuff.
Yeah, exactly. Well, I mean, so even being very thoughtful, like SIR Connect, I would have to be very thoughtful about posting something on SIR Connect. And yeah. Vicki, I know, last year you had the same. It's very easy to want to get on there and say your own opinion, but your own opinion doesn't matter, because that's not what you're representing out there.
Right.
And that's that being under the microscope thing. And then I think, really understanding that you will fail. We really need to, I think if you're going to move into a leadership position, you have to embrace the idea that you're going to fail, and just plan to learn from those failures, because not all your ideas are going to be great ideas, or you may just really have a great idea and just absolutely fail to implement it for one reason or the other. And being able to take those things apart, take the failures apart, examine them, and learn from them, and then carry those learnings forward to the next time you try, are really, I think it's the only way you'll become a great leader, is through doing that. And then in that self-doubt, being able to make decisions and stand by those decisions. And the way the sausage is made is not pretty. So I think the higher you get up in any organization, the more you see, you've got that 30,000-foot view of the world, and you start to see things maybe that don't feel as comfortable as they did from below. And all you have to I think that you have to at that point say, well, this is now I'm sitting here and I have an opportunity maybe to change those things that aren't pretty. And then I've heard this expression, the fish stinks from the head down, which I really like, because anything that you lead is your responsibility. And so if what you're leading stinks, it might be you, it might be the head, right? And so when things are just not going right, I think it's that personal insight to say, you know, what am I doing wrong, and how can I make a change here that will make this organization or this thing that I'm leading better. And I think a lot of leaders fail to recognize that it's the head that stinks. So I think kind of finally, just again, rising to leadership is about curiosity and sincerity and hard work and pursuit of that vision, that true north. And it's the difference between being a leader and inspiring people to pull and, you know, trying to be a boss and pushing people to work. So that's kind of all I had on the slides. But I want to yield the floor to Vicki for, you know, any other thoughts or comments.
Yeah, I think the way to make pursuit of leadership personally rewarding and satisfying is to make sure you're doing stuff you want to do and you believe in it. Because when you are personally rewarded and feel like you're doing the right thing and you really love what you're doing, then that list of all the things that you have to, negative things you have to deal with that come with the responsibility of leadership are manageable. They aren't always easy, but they're totally manageable and they're worth it to you. And I will say that that list of things you got to deal with that come with the responsibility are part of the reason that typically the high end of the food chain is made up of people who've been at it longer, because you just develop patience and maturity with all the stuff you got to deal with.
Yeah, it's people who've failed more.
Yeah.
Right.
Nice. I love that.
That worked for me.
A bigger pile of failures behind you.
Yeah, a bigger pile of failures.
Or under you, right?
Yeah, right.
You float up on top of.
Right. So.
Yeah, but I think that is really true. That's a great point,
Yeah.
Vicki.
And another piece to consider as you're pursuing activity in a society, a professional society like the SIR, is that one of the huge rewards of pursuing being active in the society, which is the way to sort of start towards leadership positions, is that the camaraderie and the friends you make and the professional colleagues you have are just wonderful. It's a huge reward to have professional friendships like we have in SIR. It really is a huge reward.
Yeah. No, I really view, you know, it's interesting, this cohort of people, you know, everybody's got their cohort of people that they move through their professional world with. And, you know, this group of people that's sort of in my cohort are really like family to me,
Right.
you know, and, you know, like, you know, their strengths and their weaknesses and their oddities and their foibles. And, you know, you some of them, you might love them in spite of themselves. And but it really is, it's kind of like your family. And to be able to work with a group of people that's like that are so brilliant and passionate, and so many of them trying to make change in their own worlds, where we can like synergize around the things that we care about a couple of times a year. It's really just fantastic.
It really is. Yep. So we look forward to working with you all in the future.
Yeah, for sure. Did you guys have any questions, or were there any questions from anybody?
So, well, first of all, thank you so much for this brilliant presentation. It was very insightful and down to earth at the same time. We have one of the attendees, Dr. Agnieszka Schulberg, Radchik's leader, has a question. What are some things to look out for when we may not realize we are failing as leaders? Some warning signs?
Yeah, that's a great question, Agnes. Well, I think when you start feeling like you're not, I'll use the word resonating. Like, sometimes when you're in a group of people and you're talking about something, you may feel like there's challenge, but you don't necessarily feel like sort of that vibe of resistance or resentment coming from them. But sometimes I think you actually just really, I don't know, this is probably like a super like female response, but I think if you're just really listening to people, you can start to see that they're not really on board with you. And I think at least my instinct in the past has been to push harder, to sort of disregard that feeling and just believe that my direction that I want to go is right, and they just kind of need to get on board. And I think as soon as you start doing that, you need to think that you're on the wrong path, and that you may be having those failures. And I think that's the time to sort of call it out and say, let's all regroup on this, and tell me what you're thinking about this direction. Is there a way we should be thinking about it differently? Super hard thing to do, but I think you kind of know it and you feel it. I don't know. What do you think, Vicki?
I don't have a good answer to that question. If you feel, I may be saying the same thing that you said. If you feel like you're trying to do something and you're not making any progress, then it's probably time to look inward.
Yeah. But I think it is hard to know. And I think that's when you really want to have, if you can have trusted people around you who aren't afraid to tell you what they think, your trusted advisors, then you're very fortunate. But a lot of people, I think, too, when you're in a leadership position, they're not really willing to tell you the hard things. I mean, you really have to cultivate that openness, I think, with the people around you. Not bite their head off when they
yeah, the whole trust thing.
Thank you, Dr. Solberg. I just want to remind the audience to send their questions through the question bubble, the question window. I have a few questions as well. So I love that you compared the challenges list to motherhood, Dr. Marx. I always considered my mom a leader. We all adopt leadership roles in our personal lives, and that sometimes can take precedence in our priority list when it comes to balancing out career, personal life, whether it's parenting or anything other than just work. And as a glass half full person, keeping a positive outlook and keeping on is very important. What are some things that helped you balance out the constant burden of responsibility, your worries, the stress, the failures, as well as the rest of your life?
Well, when I had the period of my life where I had real challenges, I just backed away from societal work. So I said, and in the normal stuff, I mean, in normal life, I think I have my husband is a very active parent. We have very odd gender roles at home. He does all the cooking and I pay all the bills. And we had great support at home with in-home daycare when our kids were little, and we had extended family nearby, which we engineered that on purpose. We moved extended family to live near us. And then when there's things that need to get done, we threw money at it.
Right.
But there was definitely a period of about 5 or 6 years when my my priorities were not my professional progress. And then that's okay.
Right, absolutely.
Did that answer your question?
Oh, it did. It did.
Okay.
So another question actually that I had. So part of the leadership is not just only dealing with one's division and one's department, it's also dealing with other departments and specialties. And for example, Dr. Findeiss has been working on interdisciplinary collaboration. What is the role of our leadership in breaking the barrier with other specialties, especially that now we know that there's a lot of overlap and that the hybrid models are showing a lot of clinical success, but it needs a lot of effort from all sides.
Yeah. So I think ideally, and this is so different from place to place, but ideally, if you're in a place where individual humans can act like humans with each other and build relationships that are patient focused, that's the number one way to build collaboration, pointing towards better patient outcomes. Sometimes you can have like really good humans who've been burned by challenging relationships in the past that may need to build trust again over a period of time to be able to get back to where there's willingness to collaborate. But I think, a lot of our systems have established dysfunctional incentives that really disincentivize collaboration. And I think that's where we need to be looking towards institutional leaders to think about creating incentives that improve collaboration. And so sometimes I think you have to move beyond just the individuals to sort of the system solutions to creating collaboration. So it may take, creation of service lines that are, that are specialty neutral or, not incentivizing work RVUs, but incentivizing patient outcomes. And I think we keep hoping that we're going to see, patient outcomes become our major focus rather than productivity. But we keep we're hanging off over the edge of this cliff thinking we're going to go to quality while we're still churning volumes. And I think a lot of what disincentivizes collaboration around patient care a lot of times is that volume equation that's still the basis of how most of us are incentivized. I think, for IRs that are in radiology departments, I think you really need to have a forward-thinking leader in your department who is willing to have these conversations at a bigger institutional level. And sometimes you may just have to accept that in your institution, the culture is never going to support change that's going to promote that collaboration. And I think you have to be realistic about that. Because sometimes, you can push and push and push and push. And if leadership, like high-level leadership in your organization, isn't oriented towards making those kinds of changes, then sometimes it's better to just go somewhere else where you think that can be fixed. And I'm very stubborn sometimes, and it can take me a long time to realize that a place may not be the place where things are going to happen. You have to have that institutional support.
Sounds good.
I don't know if that answered the question.
Yes, no, absolutely. It's always important to have a realistic outlook on things. And this was a great answer. I have one more question from Brian Hamadi. Did your informal leadership skills contribute to your formal leadership roles and skills? I like that.
I'm sure it's hard to measure, but
by the way.
I'm sure it does. I'm sure it does.
Yeah, sure. I think practicing leadership skills in those informal, being conscious of how you're using leadership skills in those informal leadership roles is like exercising those, and
Right.
Yeah.
learning what works,
And
learning what doesn't work.
And the whole networking aspect of that is huge.
Yeah.
People, just you getting to know other people and people getting to know you.
Mm-hmm. Yeah, it's developing your reputation.
Right.
As somebody who's reliable and trustworthy and all of those things.
Sounds good. I think we're kind of running out of time. Thank you so much for this presentation. I'm going to let my colleague Monica wrap up the episode.
Thank you, Dr. Findeiss and Dr. Marx. This is great. I think I'll probably have to watch it maybe another 3 or 4 times to absorb all the knowledge from all of this. It's been like a shock, I think, but I really appreciate it. We really appreciate it. This was really great. Thank you so much for, I know, and we all know that you have some a lot of responsibilities and some conflicting times, and thank you for taking the time to do this for us. Thank you to all the attendees and the audience. Please don't forget to sign up for the next webinar. This has been a great series. They're all recorded. We put a lot of effort into this to try to give you a different type of education that is maybe not given in medical school or throughout residency, and we kind of try to learn this at our own pace and in our own ways, and asking different people. So we thought to kind of compile the opinions of big leaders in our society to try to give you this kind of education and leadership. We will have the last session on the 19th, which will conclude with a panel, and we have Dr. Beninati, Dr. Patel, Sue Sidori, and Dr. Kohi. So, amazing people, again, amazing physicians, and overall amazing people. I think I've worked with all of them, and most of the people we try to, most of the speakers that we try to talk to give these lectures are people that we genuinely think are great leaders, not only in the society, but in their works, in their personal lives, and we have great relationships with them, and we admire them. I know that I admire Dr. Marx and Dr. Findeiss not only for their work, but for the kind of person they are, the kind of people they are. So thank you for everything, and I don't know if you, Dr. Findeiss, Dr. Marx, want to say something else?
Thank you so much for the invitation. It's been an honor.
Yeah, thanks so much. And we're excited to see how you guys grow in your own worlds, and we're counting on you.
Yeah, I'm going to retire.
Oh boy.
Not today, but at some point. Okay.
So thank you for putting this together, you guys.
Yeah,
Thank you.
Thank
Have
you.
a good night, everyone. Thanks.
Bye.
Have a great night. Bye.
Bye.